As COVID cases surge, so do the concerns for unvaccinated children, especially when it comes to the Delta variant. So they're saying that the Delta variant can spread easily in the following hotspots: daycare centers, summer camps, and school camps. Experts say that you're most likely to catch COVID from a family member. And the reason for the uptick among children includes parents heading back to work, some parents not taking the necessary safety precautions, and the fact that young children can't get the vaccine yet. So hopefully we haven't told you everything, because we want to bring in Dr. Craig Shapiro, the pediatric infectious disease specialist at Nemours Dupont Hospital for Children. Thank you so much for joining us.
Thank you for having me, Holly.
Yeah, of course. Do you think, do you agree with what they're saying is a reasoning for why we're seeing an uptick in children having this? The fact that we're seeing these hot spots in daycares and camps?
I think that the Delta variant definitely, just like the earlier in the pandemic, the Delta variant will spread more when there are large groups gathering that are unvaccinated. And because many young children still aren't able to be vaccinated, it's not surprising that we're seeing spread of this virus that now with this Delta variant is much more easily spread.
But isn't it a little more also than just being easily spread? Because, back in 2020, everyone was saying, oh, well, it doesn't affect kids as much, COVID. But with the Delta variant, we are seeing more effects. Aren't we seeing more hospitalizations, or it seems to be have a stronger effect in children?
So thankfully, so far, we are seeing some increases, especially as you mentioned, in those areas of the country that are less well vaccinated. But we still aren't seeing a significant increase in hospitalizations overall for children. Children are still less likely to to become severely ill and to require hospitalization than adults. So I think that we do have to keep our vigilance with this virus, but know that children so far seem to still be better protected than adults.
Okay, well, that is good to know. I did see over the weekend that a lot of people were comparing how contagious the Delta variant is, comparing it to chickenpox, like how that was.
Yeah, I think that was definitely not welcome news, but not very surprising given all the stories that we've been hearing, especially from Southeast Asia, that has an area that has really been impacted quite significantly from the Delta variant. We know that disease typically is worse than it was. This is definitely a different virus than we were seeing earlier in the pandemic, and so I think that we have to be even more vigilant and make sure that we're following all the appropriate mitigation measures that are being put into place by our local and state health authorities.
Well, some people are wondering, though, as we get closer to school time, though, how we're going to make sure that it doesn't get out of control when all the kids are in the classrooms and everyone's together.
Right. I think that definitely is a concern, especially for those children who have underlying risk factors that may have other medical conditions. There are parts of the country that have already put in place mandates to not allow masking or require masking in schools, which I think is definitely going to be a concern for many parents. And so it's important that I think, one, that we make sure the one thing that as a parent that we can do to protect our children is to make sure that we're vaccinated and make sure that the family members that child is around are vaccinated, because they are the most likely to spread the virus to a child. And even though there may not be a mandate in your area, you still have the ability to send your child to school with a mask. Hopefully, these schools are going to be putting in other mitigation measures, such as distancing, improving the ventilation, and even some schools are going to require testing, which I think will also help reduce the spread.
I like that you're giving tips for parents on what they can do, but I do want you to clarify, because I think it's starting to get a little muddled for people when they're saying, hey, the best thing to do is to get vaccinated so you won't pass it. But then we're seeing people saying, oh, well, if vaccinated folks are getting it and they can pass it. So what is the situation with that? If you're vaccinated, do you still carry it just as if you weren't vaccinated and can pass it on?
Yeah. So we know from this recent news from the CDC that that there are vaccinated individuals who will get infected, and they do seem to carry the same amount of virus as unvaccinated individuals. But what we don't know is how well those vaccinated individuals can spread the disease. We're still looking at that. I think the CDC is still trying to study that. But the bottom line is that people who are vaccinated will not get infected as often as people who are unvaccinated. People who are vaccinated will not get severely ill. They will not require hospitalizations. And so whether or not, whether or not the risk may be higher now than it was a few months ago for those vaccinated individuals that develop disease, it's still important that you get vaccinated because that is the best chance that you have to protect yourself and to protect those around you.
Okay. Well, more than just COVID, it sounds like right now there are some children who are getting other winter illnesses earlier. They're getting it right now in the summer, which is a little unusual. Can you talk about RSV and the increase that we're seeing in kids getting it?
Definitely. So, RSV is one of the common cold viruses, but it's definitely a virus that seems to impact those that are very young and those that are very old. And we typically see it in this part of the country in the late fall and winter time. What was very unusual is that we started seeing cases rising after the mask mandates came down and children started coming together, during the warmer weather. This time of year, it's very unusual to see the numbers that we're seeing of cases of RSV is consistent with what we typically see in the wintertime. So our hospitals are filling up with children who have these very severe respiratory infections from this virus.
So hopefully, I guess, as we continue to strongly recommend that folks wear masks, that will help with this.
Yes, definitely. But also, washing hands is also very important. This virus is also very easily spread on surfaces. So, also, all the other mitigation measures that we put in place earlier in the pandemic really did help slow the spread of many different respiratory viruses, not just COVID.
Okay. One last thing, because as we finish out the last month and a half or so of summer, we're starting to see a lot of music festivals. There's Lollapalooza over the weekend. There are a lot of headlines about that. People were nervous seeing those big crowds. We know that Made in America is going to be coming to Philly very soon. What is the recommendation? Let's say, because some music festivals are requiring you to be vaccinated or at least have a negative COVID test. Is that enough then? Does that still make it safe enough to have large crowds and it be okay, in your opinion?
So with this Delta variant, I think we definitely know that being in large crowds is not a good thing, whether you're vaccinated or not. Although, again, vaccination is your best and safest way to prevent severe infection and to reduce your risk of transmitting the virus to others. But I think it's important, to keep in mind that even though being outdoors, will reduce transmission of this virus, staying, distant as much as possible from other people, whether vaccinated or not, wearing masks, even though you're outdoors in a large crowd like that, it's always safest. That is going to be your best way of preventing transmission to other people, and in the same way protecting yourself. And testing will also help, absolutely, but I think that these are definitely set up for spreading events. So we have to be very careful when we gather in these large groups.
We certainly do. Well, thank you so much, Dr. Craig Shapiro. We appreciate your insight and the information this morning.
Thank you.